Nigukoretwo na mateta kuma kuri muingi megie kugwa kwa mitambo ya ruhonge rwa kigina kia urigiti NHIF. Amwe a Kenya makiuga ni maracokaga mihuko kwirihira marihi mao ma thibitari ona thengia wa gukorwo magatite kandi ya kumarugamirira. Na kumana na inegene riri ria muingi, NHIF ni yugite ni mani kwari na thina wa kimitambo uria wacungiriirio ni thina wa thitima, no thina ucio ni wacokirio kiruru na mitambo igicokereria wira. Murugamiriri munene wa ruhonge rwa NHIF Dr. Kamunyo akiuga kumana na kugwa kwa mitambo tariki 9 mweri uyu ni macokire makiongerera andu ihinda ria kuriha marihi mao mweri.
We actually handle close to 1 million patients every month. A glitch that we've had in terms of the system. And sometimes it's not even the system, it's even network at the provider level. But of course, NHIF is the one that will be blamed. But because it's web-based and they have to upload, if their network is down or low bandwidth, then they might have those challenges. And look at that. But that tends to be the minority.
Ningi Dagitari Kamunyo ni areganite na riboti ati kurumirira thina ucio wa thitima ndumiriri cia andu cia bata ni ciatharirio, akiuga mitambo ya NHIF ikoragwo iri migitire, guku akiuria a Kenya matikaguoyohio na ndumiriri cia maheni.
The data is completely intact and we do ensure also that we have a mirror image, a real-time mirror image of our data at our backup site. So there should not be any cause of alarm.
Na wandu aria mari na mawathe ni matetete makiuga ni maraga mamwe ma motungata na magatete kandi cia NHIF, riu makihoya kandi ino gukoragwo ikirugamirira urigiti wao.
Kama sasa nilikuwa nimelipa mwaka mzima, lakini katika ile issue zangu za kikazi imeenda chini, bado sijalipa huu mwaka. Mimi ni mtu nang'ang'ana maisha na niko na familia na niko na nini. 500 hiyo ni pesa mingi sana kwa mtu mlemavu.
Na kuona no gukoretwo na mateta megie mogaruruku maria NHIF iratabania ta imwe cia thibitari kunyihirio marihi maria NHIF irugamagirira arwaru namo, Kamunyo augite marageria uria mekuiganania marihi mau kuri thibitari ciothe iria mari na ngirimiti nacio.
The biggest change is that we simplify the contracts into 2 contracts. One that we call comprehensive contracts and another one non-comprehensive contracts. Is that we standardize the rates across all our provider depending on their CAF level. So all providers at level 4, whether it's private, public or faith-based, we are paying them the same. And so this has brought another issue of transparency and also accountability in terms of the way we are going through our reforms to transform NHIF to be a strategic purchase of healthcare services.
Ruhonge ruru rukiuga no rurathie na mbere na kwarira mitaratara na kurehe mogaruruku mari na uguni kuri muingi. Ngiribotera Kameme TV ni njitagwo Wangui wa Mwiruri.